1:45. 12:45. And thank you all for coming, those who have logged on, and we hope you're able to stay with us for the whole time. So can we ask that all people who are joining the webinar have their cameras turned off and the microphones on mute. The session will be recorded, and if you'd like to ask questions, but this is supposed to be a kind of a chat, and therefore it's really helpful if there are questions, if you can put them in the chat window, which you can see if you click on the series of icons at the top of the screen. The very first icon in the middle of the Teams screen says chat. If you click that, a window will open. I'll even do it now. There, a little column appears in black on the right-hand side of the screen, and then you can write your question there, and then post it using the little paper airplane icon in the bottom right-hand corner of the screen, and then we'll know what question you've asked, and we can pose that to the panel that we've got here. So thank you all for coming. Can I start by asking all our panel members to just briefly introduce yourself and where you work, what your job title is, and I will demonstrate by saying my name is Adrian Brooke. I'm Medical Director at Health Education England, and my background clinically was in paediatrics, and I'm an interested dinosaur from the pre-digital age in this area. So can I go over to you, Sonia, next, please?
Hello everyone, lovely to be here. My name's Sonia Kumar. I'm a GP by background, Professor of Medical Education, and I'm an Associate Dean at the University of Leeds.
Thanks, Sonia. And can we then move on to Alan next, please?
Hi everyone, I'm Dr. Alan Davis. I'm a Senior Lecturer at the University of Manchester, and my background's in nursing and computer science.
Thanks, Alan. And last but by no means least, Hatim.
Thanks, Adrian. So my name is Hatim Abdul Hussain. I'm a GP in North West London. I'm Health Education England's National Clinical Lead for AI and Digital Workforce.
Thank you. So what we're going to do is just very briefly kind of to introduce this session, really just set the scene. And what I really just want to do here is in fact, just remind everyone that the AI and digital healthcare technologies capability framework was published this morning at 10 AM and is available on the NHS Digital Academy website. So that report and the framework build on the findings and recommendations made in the Topol review, which came out in 2019 and was entitled Preparing the Healthcare Workforce to Deliver the Digital Future. And that outlined a set of recommendations preparing the NHS workforce to become world leaders in utilising digital technologies to the benefit of our patients, of course. Now, we know clinical teams in the near future will be required to use AI, artificial intelligence, and other digital health technologies effectively and equitably, really for the benefit of all. And that's starting now, actually. So this is not something for the dim and distant future. This is occurring as we speak. But in response to this need, Health Education England, HEE is how it's foreshortened, it's an arm's length body, commissioned University of Manchester to undertake a learning needs assessment and create a capability framework. And that's to aid learning and development of our healthcare workforce. Now, the framework aims to help healthcare workers identify gaps in their current knowledge and areas for preparatory activities to support digital transformation of the workforce, as well as their own individual learning. And this capabilities that we've just published build on the foundational digital literacy capabilities first introduced in a health and care digital capabilities framework. So the AI and digital healthcare framework extends this with capabilities around the use of health data and the technologies that make use of this data. For example, applications on your mobile phone or computer, wearable technologies, software and programs, etc. And this is further extended with more advanced capabilities like artificial intelligence. And of course, the advent of robotics. And capabilities, of course, range across the whole spectrum from initial awareness through implementing these technologies in a healthcare environment and supporting digital transformation projects. So I'm going to shut up now. I think that's probably welcome for everyone. And perhaps I'll turn to Hatim and Alan to present the framework. Thank you.
Thanks, Adrian. So I'm just bringing up the slides and hopefully we can all see them. Give me a second. Yeah, okay. Everyone can see the slides. Adrian, do you want to just give me a... Yeah, perfect. All right. So, I mean, between Alan and myself, we're just going to go through the methodology behind the framework and a brief overview of what the framework includes. But when I was reflecting on what I'm going to say today, I was just looking back. When I started my GP training as a registrar and started my first placement as a GP in a practice in Hayes, I was doing majority face-to-face consultations and practicing in a way that seemed very familiar to me. And I think going back, probably only about 2 or 3% of my consultations were even telephone-based. So the majority were with the patient in front of me. I then went into accident and emergency as a trainee, and we hit the first wave of the pandemic. And being in accident and emergency, I noticed certain things. So I noticed how suddenly our nursing staff in accident and emergency were collecting observations on a device and were inputting them onto a system.
Hatim, people are struggling to see the slides. So we've got messages in the chat that says they can't see the slides.
Let me see if I can share those again.
Quite a few.
Give me a second.
So maybe if you go into presenter and all the we all disappear, that might be easier. Can someone message to say where the slides are now? Yeah, we've got some. Yes, okay. We've got lots of thumbs up.
Wonderful.
Thank you,
wonderful.
colleagues. That's really helpful.
So being in A&E, I noticed that things were changing. So nursing staff were recording observations on a system, and we were having to access that system to be able to look at observations. We had new healthcare records that we were using in that emergency department. And I remember going in on one day in paediatric A&E and being told we've got this new system in place, and not really being shown how to use it, not really being having had the time to really familiarize myself with the system. I then went into general practice and noticed the whole world had changed. When I logged into my system, I suddenly had widgets on the screen that allowed me to text and receive messages from patients. And suddenly when I was looking at appointments, I had something called an e-consultation where people were giving me information beforehand and then I had to act upon in thinking about what I was going to do going forward. And all of a sudden I was doing about 50 to 60% of my consultations, either via the telephone or in some cases even by video consultation. And I reflected on how, one, we got to this stage, but two, whether I felt that I had the best skills in place to be able to work in this new way. And I was also at a point where I was preparing for my general practice exams, and a key part of my exams was to record myself consulting with patients, and a lot of these consultations were over telephone and video. Now, that became an opportunity for me. It allowed me to really analyze the way I consult with patients and to reflect with my educational supervisor around how best to do that and what kind of mitigation I needed to take when I'm consulting with a patient over a video call rather than over a phone or versus a face-to-face consultation. And so when I came into my role at Health Education England, it was very important for me to think about how we do our best to help people understand what they need to know to be able to work with the types of technologies that we interact with patients with. And so that's really the key context behind why this is important. It will enable people working in health and care to be able to understand the types of skills they need to have when interacting with people, interacting with patients, and using technology. Passing over to Alan, and I'll move the slides along.
Thanks, Ati. So I'm just going to talk very briefly about the sort of methods we used to create the framework. So we used an iterative mixed methods approach to create it that involved co-design as well. So this involved carrying out a systematic literature review to look at the academic side of things and where the different gaps were, and also a series of workshops which we did online, and then that was followed up by a digital survey as well. Next slide, please, Ati. So the systematic literature review is really used to generate some initial concepts, and this was carried out by Health Education England's knowledge and management team. And we also include, as well as the academic literature, we looked at the grey literature. So we looked at existing frameworks, international frameworks, and other relevant policies and documents. And we used this to generate a set of really groupings of topics and themes and concepts. So looking at the different things that were coming up constantly in the literature that were seemed to be important, and we grouped these together roughly into what we called a concept map, and that acted as the basis for the workshops to give people a starting point so they could look at the kinds of technologies and things that we were talking about under those different main areas and spark the debate really. So if you move to the next slide. So we carried out the workshops online. It was during the pandemic, and we used a thing called Miro, which is an interactive board that allows multiple users to work at on the same page basically. And we also put people into breakout rooms. And the series of workshops targeted different stakeholder groups. So the first one was really around so there are people like the Topol Fellows there. We had NHS clinical entrepreneurs. We had, in the second group, we had industry representatives. So this was Babylon Health, Google Health, Barclays and Bupa, and the final workshop was focused around subject matter experts. So we used each of these free workshops to use the topics to spark discussion and consider what the different capabilities might involve. And then we were able to rank these in order of importance and complexity. Next slide, please. We use something called the nominal group technique for the workshops, and this is quite a useful technique when you've got people that aren't familiar with each other, or you might have power dynamic imbalances. So essentially you've got this nominal phase where you privately consider the information, and we did this offline prior to the workshops. And then we have an item generation phase. This is all around ideation, so people come up with ideas without being interrupted by others. And in this, we captured that on post-it notes on the Miro board. And then you go back round for clarification and discussion, where you can kind of probe into the different ideas and ask people to explain them. And then finally, there's a voting stage where you're able to order the priority of the different items. So we used this to generate a draft version of the framework. Next slide, please. And then we sent that draft framework out via a survey for wider participation, so we could get more people to give us feedback. We took that feedback on board and then constructed the final version of the framework that you can see in the report. Next slide, please. So the framework is, as mentioned before, it's built on top of the original digital literacy framework, and that forms the foundation. And then on top of that, we've got a lot of skills around data. So obviously for a lot of these advanced technologies, wearables, AI, machine learning, they're all built on an understanding and use of data. And then on top of that, we've then got those technologies. And then on the higher end, we've got things like artificial intelligence and AI. So it's built up in that way, basically. And it sort of straddles the space between the original digital literacy framework, which is very much around basic digital competencies, so can you switch your machine on, send emails and do all these fundamental digital things. And then at the other end, we've got special frameworks for special groups like informaticians. And this framework very much straddles that space in between the expert frameworks and the very fundamental digital literacies. Next slide, please. So the other problem we had here is, how do you make a framework where you've got so many different types and roles in the NHS, so many different types of workers in the NHS workforce? So it'd be quite a challenge to map these capabilities onto all those different working groups. And the other problem is some of these working groups will have different roles. So you might be a clinical nurse, but you might also be involved in informatics projects, for example. So you might wear multiple hats. So to get around this, we use archetypes instead. So essentially we map the capabilities onto archetypes, and then people can self-identify which archetype or archetypes they belong to, or their managers can do this as well. And the archetypes include things like shapers, so this can be people in leadership positions or arm length bodies. We've got drivers, so this can be your CIOs and CCIOs. Creators, so these are people that are actually creating some of this stuff, engineers, data scientists. And then we've got embedders, so these are people who are actually embedding some of these things into the various systems, so IT teams and so forth. And then we've got the users as well, so people actually use the technologies. And it is possible that you can come under one or more of these different archetypes at different points. Next slide, please. We also use something called Bloom's digital taxonomy. So for any educators out there, you're probably quite familiar with Bloom's. It's quite a popular framework that's often used in education, and this is a digital version of that framework. And we mapped all of the different capability statements onto Bloom's taxonomy as well. And it really includes moving from lower order thinking skills through to higher order thinking skills. So at the lower end, you've got things like remembering things and basic understanding, moving through to application, analysing, evaluating, and then creating. So we use Bloom's taxonomy across the framework and through the different sections as well. Next slide, please. So the framework itself is split into a number of key domains, and these domains include things like digital implementation, digital health for patients and the public, ethical, legal and regulatory considerations, human factors, health data management and artificial intelligence. Next slide, please. And a number of these domains also have subdomains. So you can see there, for example, that they break down further. So AI includes things like robotics. We've got things like management and leadership under human factors, and ethics and regulations under the legal issues and so forth. And inside each of these, we've got a number of individual capability statements. Next slide, please. So on each of these domains and subdomains, we've got a number of statements split into 4 levels. They're split into 4 levels to make this compatible with the original digital literacy framework, so it's a familiar structure, and the levels really just infer increasing complexity or difficulty. So level 1 is going to be easier than level 4, and then within each of these levels you've got the actual capability statements themselves, and then these are mapped onto those different archetypes that you can see at the bottom there. So that's a quick whistle-stop tour through kind of how we designed the framework and kind of what the framework consists of, and I'll pass back to Hatim.
Thanks, Alan. And a key message here is, so it's great, we've got a framework, we've got an idea at a very early stage of what these capabilities might be, but how do we make sure that 1, it's sustainable, and 2, we get the impact we need to get in terms of me being in my clinic room as a GP, the types of skills that I would need to be able to work the types of technologies that I'm interacting with. And so the first thing is to say that technology is fast adapting, and in our framework we've done our best to make sure that we're technology agnostic, but we need to make sure that we continue to keep live to advancements and developments in this area. And so we're going to be doing some work to make sure we have a mechanism in place to continue to review and refresh the capabilities within the framework, as well as build in new areas as things emerge in policy and in healthcare. The second part is we want to empower individual learners to be able to use this framework, so it's about embedding it into existing Health Education England learning platforms or tools, such as the Learning Hub, so that individuals can really measure their own learning, their own aspirations for where they want to get to, and that will then drive them forward in terms of what kind of skills they develop based on that material out there. And then the final part is to be able to make sure we're working with their educational bodies, like people like Sonia, who's working within a higher education institution, or our Royal Colleges or our professional regulators, to be able to support the educational reform that we need as a result of the learning that we have developed over the past 1.5 years in developing this framework. And so that we know that when I am entering my GP training, I have it quite clearly within my remit to be able to develop these skills naturally within the competency and the capabilities that I need to build as part of becoming a GP. I hope that's been a helpful overview of the framework, but I'll pass it back now over to Adrian for the discussion.
Thanks, Hatim, and thanks, Alan, for a kind of a lightning tour through the rationale, background, development, and deployment of the framework. So thank you very much. What we'd like to move on now to is a discussion on how we can implement that framework in undergraduate and postgraduate training. So and I'm going to turn to Hatim and Alan and Sonia. I mean, we have got this, you know, this funny triad between, if you like, the individual, the framework, the places individuals are in, for example, you know, postgraduate or undergraduate courses, and we've got the changing landscape as well. So we've got lots of moving targets. And of course, we've got a regulatory framework as well to navigate as well, because healthcare is a highly regulated field for obvious and very good reasons, which may not always be quite as adaptive, I would imagine. I don't know if anyone would like to kind of comment on some of the difficulties that throws up, or, you know, maybe around assessments or stuff.
I can go first. And so when we kicked off this piece of work, I think we made it very clear at the start that we needed to be engaging with educational bodies right from the start, to be able to help them understand, one, why we're doing this, and two, how they might use the product at the end. And then some early examples of where that's been in effect is, for example, the British Institute of Radiology. So we did a piece of work in January of last year that looked at the AI and data-driven technologies in the NHS and what workforce groups they affect. At the top of that tree, we saw radiology, radiologists, and near the top, healthcare scientists as well. And so in further conversations off the back of that with the British Institute of Radiology, we were able to say, well, look, this is going to be really important for your membership. It's going to be really important for those that are working in the professional groups that you're responsible for. What can we do to enable that learning that these groups need to have to be able to work with these technologies? And we've got a webinar series and some learning materials that are being developed by the British Institute of Radiology and are launching at their AI annual congress as well in a few months' time. And so the key is to find the bodies that are, you know, really valued the importance of this and are looking to work with us to build some of that proof of value for the learning in this space.
Thank you. So it sounds like some colleges are kind of acknowledging this, and, you know, sometimes we say in education, don't we, that assessment drives learning. And therefore, if you're going to be asked about it in the exam, that's quite a powerful driver. Clearly, a lot of the workforce is not in training or education, but is post-training, as it were, in service roles, but still needs to know. So that if you like, the examination pressor to make you learn is slightly less urgent. But I'm just wondering, for example, stuff like finals for undergraduates. You know, what's the inclusion of the digital kind of agenda in that, and how might this framework relate to that? Sonia, can you? Yeah. I know you're a GP, but I'm thinking things like licensing exams and stuff like that.
Yeah, no, I've been involved in medical education for quite a number of years. I mean, I have to say, first off, I mean, I'm really excited by this because it's a very clear outline of the domains that you need to consider with digital health technologies. But I think equally, I'm also quite worried about how the health service is sort of moving at breakneck speed in how we're adopting digital technologies, and indeed how society is as well. We all know that there's Google, there's wearables, there's apps, you know, digital health is part of our everyday lives. But yet, when you look at the training needs and how it's being integrated into undergraduate curricula, and that's across the health professions, postgraduate curricula, you do start to think that actually digital health at best is sometimes mentioned. It isn't a strong theme, and I think one of the really sort of beautiful ways of highlighting this is the medical licensing exam, which comes in just for medical students in 2024. Doesn't really mention digital health, even though it does have an area around capabilities. I did a bit of a look yesterday, and I was putting in words like technology, digital, remote consulting, anything that could encapsulate what we're talking about today, and it just isn't reflected. And that's new, that hasn't even been launched yet. That's coming out in 2024. So that disconnect between what society is moving ahead with, what the NHS and HE is moving ahead with, but yet how educational bodies, and that's undergraduate and postgraduate, are sort of somehow lagging behind, I think will be a problem, not only for dissemination of this framework, but actually the bigger thing is actually how are we supporting our patients, rather like you, Hatim. I remember a patient coming in with their genome profile, and I had a student in with me. You know, I was totally out of my depth of how to counsel the patient about their risk for various conditions. So not only is there a training need for our pipeline, our students, there's a huge training need for our trainers, you know, who is going to be teaching our students all of these 6 domains around digital health. So I don't know, I don't want to use the word emergency, but I do think there is a digital health emergency that we need to address.
Thank you, Sonia. That's a really kind of powerful, almost call to action, isn't it? that we need to catch up across the system. Maybe this reflects a wider societal issue where we've got the kind of inexorable and ever quickening march of technology, and across society we struggle to catch up and are playing catch up with it, both from a kind of legislative point of view. And if you like, this is an aspect in a part of medical education or healthcare education and practice. So I think that's a really powerful observation. We have got this strange situation, have we not? And I'd be interested to hear people's comments on this, that that everything is moving really quite rapidly. Now, normally in a lot of healthcare knowledge and understanding, it's sort of held behind a kind of a bit of a mystic shroud of learning, isn't it? So we've had this aspect of the doubling time of medical knowledge, and it used to be 50 years and then 25 years and then 10 years, and I think it's currently at about 70 days and shrinking. But for technology, which is often released in a commercial setting first and then adapted for healthcare rather than the other way around, actually, if you like, our public are way ahead of us in terms of their use and often their sophistication, certainly for some parts of the population. So I think that's another challenge. How do you think the framework will help our healthcare workforce, if you like, map their progress in a learning journey that helps equips them to meet that challenge? Perhaps I'll ask Alan, because you described the construction of the framework.
Yes, thanks, Adrian. I think it has the potential to do that, definitely. We've certainly been we've put parts of the framework and mapped that against our new clinical data science program, for example. So we're trying to try and embed these things in some of those postgraduate work that we're doing. We've also got a lot of stuff going on in nursing at the University of Manchester. So particular modules and courses, you know, a lot of them tend to be postgraduate focused though, because you know there's a lot of crowded curriculum in a lot of these medical professions. So in medicine and nursing, they're always putting more and more things in, and obviously digital is very important, but often we're seeing you know that it's maybe not getting the attention that it deserves. But some people are also trying to embed that into normal kind of practice and put it into other units and other things, which I think is a good idea. It's another way to embed some of the digital stuff in there as well. So we're seeing sort of more and more adoption of these things, and if it can be incorporated into other modules and interdisciplinary learning as well when we're working with other professional groups, because that's what happens in reality, isn't it? You're going to use this technology a lot to communicate with other groups and other departments, and really we need to start embedding this early on in the undergraduate and postgraduate curriculum. So I think definitely having that framework and the ability for people to sort of look at that and see what those requirements might be certainly gives educators something they can start to work with and start to make sure that they're including some of those main elements. So
early adoption, dissemination and uptake, kind of key themes, I think, coming out, Alan, of your answer. And how might you see that, for example, Hatim or Sonia, in GP training, given that that's both your clinical backgrounds? Is that something you've seen? I mean, I don't want to make presumptions, but I suspect Hatim's slightly closer to training than Sonia, but maybe not very much so. But from your point of view, Hatim, have you seen that, or Sonia, have you seen that in practice?
So my reflection during my training is I think that we're on a journey here that similarly we were on with leadership, with quality improvement, which are areas that have fell in quite naturally into the GP portfolio or the GP kind of workplace-based assessments. Now, when I was training, that whilst there wasn't a specific section around digital, I made sure that I did a lot of reflection on the way that I use digital tools in the way I interacted with my patients, and I spent a lot of time thinking about, well, actually, did that make things better? Did that help the case, or did that actually make things worse? Was that the right modality to choose to communicate with that patient? Was I excluding them from care by using that modality? And I spent a lot of time reflecting on these things more naturally, purely because it was important to me. But I think we do need to create the conditions within the portfolio to support people to be able to do that reflection, and to be able to understand that better, because ultimately this is all about safe, ethical patient care, and to be able to deliver safe, ethical patient care, you need to be able to be competent in working with the tools that you're working with and understand their strengths and their limitations.
I just sort of, I suppose, just adding from an undergraduate perspective, you know, I think the evidence around, I wrote a paper around this, the evidence around how you teach digital health, how you actually embed this in curricula is quite sparse. So I think that there's a real gap there, is how do we actually get this information and skills and values around digital inclusion out to our students. Clearly, PowerPoint's not going to do it. You know, teaching our students all of this in lectures isn't going to do it. I mean, one thought that I have is one, and this is bringing in my experience around community-based learning and being a GP, is that students, and also just building on what you said, Hatim, around quality improvement. One thing that I have done, previous to my role at the University of Leeds, I was at Imperial College London for 10 years. And one thing that we did there is that the students, year 3 medical students, did what we call community action projects. And we sort of focused these around hot topics such as COVID vaccine hesitancy. And just one thought is that students could do quality improvement projects with communities, in that they learn the knowledge base and the skill base around digital health, but they do that through working with communities in upskilling communities in digital literacy. So you sort of have a double win there, that not only are the students learning, but actually they're learning through service. Because I do think that we need to think about training needs, not just of our healthcare professionals, but also the gaps in patients. We need to empower them so that when they are coming with information, they've been able to do a little appraisal of the information themselves, and that they're not spending huge amounts of money and time on digital health technologies that may not be best for their health.
Thank you, Sonia. That's a really helpful insight, actually. So we do have a question, and so thank you for the questions and comments which are coming through on the chat. We have a question from Jane Daly that whizzed in at 12:29 for members of the panel that want to look at the question before I fire it out to all of you. So it says, digital first will only be integrated or embedded if workforce contracts and the reward and recognition system is revolutionized. How does this align with critical and strategic workforce planning? I've got horrible things I read that and I might come back my way. But does anyone want to kind of start off with that as a response?
Yeah, I can kick us off, and actually, Adrian, it'd be great to have your views on that as well. But I guess the way I see this is it's important. This is particularly a group that we haven't necessarily focused on just now. We've been talking about undergraduate and postgraduate training, but actually, there's a whole group around continuing professional development who are out there working in the NHS that will need to equally have these skills looked at and be able to kind of be supported to be able to keep their skills up to date or develop their skills where gaps lie. And I think the key here is culture of an organization, top-down leadership in terms of saying this is important to be able to develop the skills in this area, making sure that these things are built into annual appraisals so that you're able to at some point, you know, look at your digital literacy, use as something like a digital self-assessment tool that we're developing at Health Education England and piloting in the north of the country, to be able to say, where am I right now and where do I need to go, and have a really open and frank conversation with your line manager in terms of how you then develop those skills and why it's important that you develop those skills. And so if you have all of that kind of naturally happening within an organization, you're going to be more digitally mature as an organization. And so it's important that we work with providers to be able to enable that.
Thanks, Hatim. Yeah, I mean, I think from a workforce planning is really quite a complex thing, isn't it? Because a lot of planning is there's kind of short, medium, and long-term planning, and some of that planning, long-term planning assumes, or if you like, has foresight that there will be a great deal of digital technological change, and yet it can't be exact in articulating exactly what it will look like or how it affects, if you like, the what's often known in workforce planning cycles as circles as productivity, or your workforce requirements, or your learning requirement even. So it becomes really quite an inexact science at that stage. And as we know, kind of current progress is not always a good kind of predictor of future growth in the area. So it should be quite easy, I think, is the answer. It's actually very, very difficult to do accurately beyond very broad assumptions. I think that's one of the issues. So it's a really good question, kind of highlighting some of the difficulties in trying to do that. I think reward is a really useful kind of local example of how you can reward your workforce for training and pursuing that that knowledge journey and competency and capability journey amongst for digital. And we know, for example, there are areas of practice, and so if we take the example of diagnosis of stroke, where AI technologies for imaging to diagnose kind of strokes which are amenable to intervention. I think that's my understanding of the technology that's being used. That's grown from about 10% uptake a couple of years ago, and it's about 70% of units are now using it. So there's that rapid growth. It would be quite hard to predict, although it's incredibly welcome. And some of the other technological learning advancements, which require greater interplay with, if you like, skill, individual skill, might take a bit longer, and of course need guarantees and regulation, because you don't want to be doing robotic surgery on people if you're not properly qualified to undertake that procedure, for example. It's a very simplistic view. So I think, Alan, you have your hand up, so please do come.
So I think Hatim was first.
No, that's fine, Alan. I took it off. Go for it.
I was just going to say another thing that I think is quite important with this as well is we talk a lot about the digital literacy, but as the technologies get more advanced, they're often closely associated with data. So there's this concept of data literacy as well, where if you're not putting the right data into it or doing that in the right way, obviously what you get out of it can be affected. So I think that's another key thing, is also having access to this data for people to learn from as well, and to learn how to use data. And therefore, so it's not just the tools that we need to sort of teach people, it's the data that goes into the tools and how that's collected and maintained as well, as it were. And also, we often have trouble with that in academia, getting access to real data sets and things like that to train people on. So we're looking at things like synthetic data and, using things like electronic health record systems and using sort of fake data and things like that. But again, the sooner we can get people using some of these tools and the data that's associated with it as well, and getting them comfortable with using data, that's going to help as well in this area, I think.
Great. So there's a really good question from Catherine Worley at 12:34 for the timestamp aware amongst the panel, which says, do we need to upskill the trainers first? Can't teach effectively something you don't understand yourself, which is a fantastic question, Catherine, and incredibly true. So who would like to have a go at answering that? Hatim, I saw the ghost of a nod there, so that means it's you.
No, I'd love to hear Sonia's opinion on this as a senior educator. What your thoughts are in terms of, one, I think I'm hoping we're all going to say yes, and two, how do we then do it?
Well, so I suppose just turning this on its head. So this is pre-COVID, I think 2017, 2018, or maybe no, it was around 2019. It was around the time of the TOEFL review. I set up a module for medical students called Digital Health Futures, and looking at it, it wasn't particularly forward thinking, but you know, it was on the basis of the TOEFL review, which was where we really started to embed some of this learning for medical students. And what became apparent, exactly as you say, Catherine, is that none of us really knew as much as the students. And so that really is where the light bulb hit, that actually I do wonder whether it is the new generation, it is our students that will be upskilling us. Obviously, we don't want to do complete reverse teaching, but I do think there is something about co-creating any curricular changes with our students. They are so completely savvy, not only with just digital tech on their iPhone, on their smartphones, but also around that. There are a lot of students that are really really excited about digital health and know a lot about it. And so when we ran this module, the students were absolutely teaching us. And so when we developed the module and we presented some of our work at conferences, we were very much working alongside students. So I think the how has to be with the new generation who have been brought up with digital education and digital health.
Great. And of course, there's nothing to stop our educators from using the same capability and competency framework themselves, plot their own journey, and make sure they're teaching to the right level. That, as you say, you've got to understand a subject properly to be able to teach it well. I think that's one of the really important observations. So we're just coming to the end. We've got the last couple of minutes. So there's one very quick question, which I'm hoping there'll be a really quick answer to, that I think talks about the digital literacy assessment from Kerry O'Reilly. This is a digital literacy assessment. Is this available for wider use?
So yeah, to my understanding, the digital literacy self-assessment tool is currently being piloted. It's not open for wider use as of yet, but hopefully will be soon. And I'll share a link in the chat to the website so that people can stay updated in terms of its progress.
That's brilliant, fantastic. There are lots of really interesting and insightful comments on the chat. And I can reassure you as we approach the last minute of the webinar, because I think we log off at 12:45, that a recording of the webinar will be made available, and it'll be on the Dart Ed web pages. And we'll add a link in the chat, which I hope will come soon. And there's a Twitter channel at NHS Digital Academy. So I think this conversation and the developments can be followed on that on Twitter. And I think I hope the link can get posted into that as well. So I would really like to thank our panel today. I'd like to thank Sonia for her input and development of this. I'd like to thank Alan similarly. Thank you so much. And I'd like to thank Hatim for really kind of helping coordinate and drive a lot of this in HE. So thank you so much. I'd also like to thank Beth and Emily, who you won't see on this webinar, but basically without their abilities to organise and corral us, four of us, into a room, albeit virtually at this time, none of this would happen. Thank you so much for listening and tuning in, and I hope we'll have further conversations and look forward to you all joining us in the future. Thank you. Good afternoon.